my name is Lila Galustian. I go by Lily a lot of times. I'm a licensed marriage and family therapist. I specialize in personality disorders and the development of personality disorders, adults and adolescents, and I'm the owner of Rediscovering You. It's an outpatient program that utilizes cognitive behavioral therapy and dialectical behavioral therapy to help reduce symptoms and hopefully remove unwanted behaviors and symptoms.
Why do people go to therapy?
Therapy is something, as we're living as humans, there are times in life, and this is not just severe mental issues, there are times in life that we're not feeling satisfied with ourselves. There are times in life that we keep doing behaviors and we keep doing things that cause problems for us in our social environments, in our work or school environments. In a sense, we're just constantly experiencing negative experiences in life. And those are a lot of times when people go into therapy, or it's appropriate time to go into therapy and start asking yourself, what are you doing that these things are happening in our lives? There's other reasons as well. There is severe mental health reasons why people go into therapy, kind of like schizophrenia and things like that start happening, which you start experiencing some symptoms of it in your adolescent years, later in the adolescent years. And in those times it's harder to seek help because it's like experiences happening inside of you that are very scary. And a lot of times with mental health experiences, people feel shame. And the shame causes them not to ask for help. And the embarrassment of something is wrong with me, and I don't know how to talk about something is wrong with me, prevents them from coming to ask for help. But those are appropriate times to go to therapy. So therapy is something that just helps you find yourself, find and understand and help yourself do better as a human being, and find a more quality of life instead of a life that's constantly filled with consequences and negative experiences.
And how do you know what kind of therapy is for you?
There's so many types of therapy. There are so many amazing types of therapy. And one of the things that I always tell people is it depends on what you're going in for. So if there's a behavioral problem, if there's something that you keep doing, if there's like something within your thoughts that, like, let's say you're ruminating or you're a very hyper person with an intense hyper mind, that's not the type of therapy you want to go and process. You don't want to do psychoanalytic, psychodynamic, where it's all about talking about your mom and dad and how these things affected your life, because that's not going to fix your hyper mind and your thoughts. If you're engaging in behaviors like you have anger outbursts or you're having relational issues, again, not process-based therapy is going to be helpful for you, because those are behavioral patterns you have to change. Those are things that within yourself you have to rewire in your brain. And so you want to seek behavioral therapy. Behavioral therapy is very change-based. It's very teaching you how to do things differently. It's a lot of internal work. I call it like going to the gym. You have to practice things every single day and start changing like behavioral patterns, which means you have to change your brain patterns, which is not an easy task. And then more process-based therapy and therapy that aren't necessarily evidence-based. They're still very helpful. As clinicians, I really suggest using some of the process-based therapy techniques in the therapy room, because they do help in so many different ways to help the person understand the problem or find willingness, understand themselves, and then implement the behavioral changes. But a lot of the process-based stuff is more for people that just, they want to go deep into understanding something about themselves and they want to pathologize themselves. And there's a lot of curious people that are functioning, that are healthy, that have a good social support, that show up to work every single day, that have pretty good like understandings of life, and they're doing a great job, but they just kind of want to understand their childhood a little bit more, and they want to dig deeper and pathologize themselves. Those are more the process-based and non-evidence-based therapies I would recommend for those people. Behavioral therapies are people I recommend that are looking for change, looking to do something different because their life, they're not feeling fulfilled and happy with what they're doing and how they are.
Why did you focus on CBT?
I love evidence.
Okay.
For me, evidence-based really is something that's concrete. And then as I was studying all of the therapies, I really love humanistic, I love Jungian, I love all these, like, in a sense, I call them like spiritual kind of concepts that like is about the person in the room. But I love them as techniques, as being able to help people, especially because I started working with early development and children. And then I was working with borderline personality disorder more. I really saw how cognitive behavioral therapy and dialectical behavioral therapy really helped people change their behavioral patterns. And really there was a lot more success in the treatment plan as a clinician, because we have to plan. They come in with the concepts of what they want to change. You create a treatment plan, and as a clinician, you work with that treatment plan. It's kind of like the medical field in a sense. And those treatment plans, actually changes were happening, and the people sitting in front of me were successfully accomplishing their treatment plans with behavioral-based modalities. And I started practicing the skills myself in my day-to-day life. And it just made me a better human being. So I'm a big fan. In our world, people like to say I drank the Kool-Aid, but I think for me it's not even about drinking the Kool-Aid. It's that I firsthand have experienced it in my own life, how much it's helped me in my quality of life and my self-esteem, and my relationships and my work and everything. And on top of just me, I've seen it time and time again for the past 12 years with patients sitting in front of me. The ones that actually put in the work, practiced the skills, were really motivated to change, they successfully changed and are now, from what I know very little, because you don't stay in touch with your patients often, the ones I know are doing amazing work.
This is just, so DBT, what's DBT stands for again?
Dialectical behavioral therapy.
And that's like, because I want to make sure I asked the question correctly. So my next question is going to be about, like, does DBT, like, I want to kind of tie in DBT to CBT.
Okay.
So, but DBT is a type of therapy as well, right?
Yeah, so DBT is dialectical behavioral therapy.
Right.
DBT derives from cognitive behavioral therapy.
Gotcha.
So cognitive behavioral therapy is pretty much the godfather of behavioral therapy. Cognitive behavioral therapy came first. And cognitive behavioral therapy is the evidence-based behavioral therapy by Aaron Beck, who came up with the concept that, and based off of studies, it's very evidence-based. There's a lot of like universities that did these studies. It came out of our thoughts play a role in the way we feel our emotions. And our emotions, which this is kind of just a thing for everyone to understand, our emotions are signals to our brain of how to behave, right? So like if we're experiencing fear, the fear is signaling to the brain to go into fight, flight, and freeze. If you're experiencing happiness, the emotion is a signal to the brain to put on a happy face and feel these positive emotions. So our emotions function in the human body and the animal body as a whole, not just the human, because we are animals at the end of the day. Emotions send signals on how to behave. Our thoughts come from our memories. Our thoughts are from our development, as like, I'm sure we've all seen little babies from 0 to 5. As they're like growing up, all you see them do is like look around, and they're just taking in information, right? And they're starting to fill up their cup of memory. And slowly, as they start walking, that like starts creating neural pathways of teaching the brain and the body of how to walk, and it becomes second nature, so they don't have to think and practice it anymore. But all of these things that we're taking in are going into our memory, which then at some point become our thoughts that send signals to our emotions on how to behave. So cognitive behavioral therapy is your thoughts affect your emotions, which then affect your behaviors. And this triangle can go either direction. Dialectical behavioral therapy is something that Marsha Linehan came about. She brought it from cognitive behavioral therapy. She specialized in working with chronic suicidal behaviors. That was kind of the population she was focusing on. And she realized, which is mainly borderline personality disorder is the one, she realized cognitive behavioral therapy is a very, very challenging, very, very change-based behavioral therapy. And it wasn't necessarily helping these emotional people come to a place of learning how to change their behaviors. So what she did is she started implementing a lot of mindfulness, a lot of Buddhist acceptance aspects on these heightened emotions and our thoughts, and kind of started implementing a lot of skills that I call holistic skills. When I talk to people about dialectical behavioral therapy skills, it's very simple holistic skills that people have been using for such a long time. It's like one of the skills is start paced breathing. Slow down your breathing and regulate your emotions with your breath. Another one is put cold water on your face or warm your body up. If you're getting very emotional and you're getting cold, warm your body up. If you're getting emotional and you're getting hot, put cold water on your face. Stop. Think of telling yourself to stop and take a step back from the impulse control. So dialectical behavioral therapy skills for me are very holistic skills that tend to help everybody. There are skill sets that we forgot how to use with our emotional impulses. I can't really blame it on technology. I can't blame it on much, except society's just a lot more less paying attention to their emotional responses, which emotions, again, tell us humans how to act and behave based off of our memories of how we've acted and behaved in the past or how we've been taught to.
Right. I'm sure it's because, like, also in society, it's very go, go, go. Right. So the last thing you're thinking about is what's my emotional, what do I feel emotionally right now?
Yeah.
And does that, does that kind of go, go, go lead to other disorders, like the disorders that you focus on, I'm sure, like personality disorders or so on?
It does in a sense. Personality disorders, they're two aspects that play a role in developing personality disorders. The first aspect is the emotional intensity. So every human is born with an emotional, what's the word? Every human is born with an emotional temperament. Right? And we don't really understand just yet. I don't think there's been any studies that have been shown why every human being is born with an emotional temperament. Last I've checked the studies, there hasn't really been anything of like whether it's genetics, whether it's like what plays a role in each individual that's coming into this life.
And what is emotional temperament?
An emotional temperament is, there are some people that are born with a heightened emotional reactivity. So they're born with
Short fuse, basically.
In a sense, but they're born with experiencing their emotions intensely and very quickly. And you see it from infancy. And it's not just negative emotions. So a lot of the times people, when we talk about emotions, and we talk about mental health and emotions, people's straight thought goes to like sad, angry, anxiety. But it's not. When you're born with a heightened emotional temperament, you also feel happy in a heightened state. You also feel lust in a heightened state. You feel love in a heightened state. You feel excited, which also mimics anxiety in a heightened state. And then there's an aspect where there might be a slow return to baseline, because we have, the way that the human body works is your emotions they kind of react, right? And then each emotion has to come down to a baseline. So we have people that have heightened emotional reactivities and a very slow return to baseline. So on average, it takes them 30 to 45 minutes if there's no other external or internal cue that ignites another emotion and makes it keep going up, right? Then you have people that have like heightened emotional reactivity, but a quick return to baseline. So they might be emotional people and they regulate really, really fastly. So they can like find the balance, they don't get invalidated as much in the world, and they don't have as many problems as often as people with a personality disorders tend to do. Then you have people that don't have a fast, like quick reactivity. It takes them time to start feeling their emotions. It's like multiple things have to happen for them to hit a heightened state, and either they have a slow return to the baseline or they have a fast return to baseline. If they have a fast return to baseline, they got the luckiest of all the temperaments because they barely get emotional and they have a quick response back to like being able to regulate themselves. It's amazing. But that also for itself causes its own mental health concerns, right? Or internal dilemmas, and internal conflicts. Because you're starting with what we do as we're growing up and as we're developing, we get to an age that we start comparing ourselves with the kids around us. And then those comparisons is like, why am I different? The ones with heightened emotional reactivity and a very slow return to baseline, if they have an environment that does not understand them, if they have an environment that's constantly invalidating them, invalidating their emotional experiences, if they have an environment that's constantly saying things like, why are you so emotional? Which if we kind of take it back to cognitive behavioral therapy, if a kid is learning why are you so emotional and that's going in the memory, that's a thought that's going to ignite an emotion that's going to create a behavior, which a lot of times the emotion might be sadness, might be disappointment, and then the behavior might be like, I need to figure out how not to be emotional. So I need to engage in self-harm. I need to run away. I need to, whatever that child comes up with as a coping mechanism to avoid being invalidated by their emotions. That's how personality disorder traits start coming about. That's specifically borderline personality disorder. We also have narcissistic personality disorder, which is they have their emotional temperament, but they don't really, the only validation they get from people is by being told, you did something good, you have to be a success. You only if you're a success will I validate you, and every other time I'm going to ignore you, and I'm going to treat you poorly, and I'm going to say things that that are like going to make you think that you're grandiose, but the reality is I don't believe that you're anything at all. And there is parenting like that, unfortunately, that creates narcissistic personality disorder. And then you have sociopathy, which sociopathy is from a very, very young age. They experience unheard of painful experiences that you don't want a child to experience, where it kind of cuts down their empathy from a very young age, and it builds a lot of hate and anger. You have very different personality disorders that kind of develop based off of the emotion and the environment. Personality disorders are very big on the environment and the development and the parenting. And with all of them, I say it's every parent is doing the best they can. I specialize with borderline personality disorder, so parenting with borderline personality disorder is whether parents would like to hear it or not, and it's not always parents, it could be other people in the social environment, but it is invalidating, not understanding, and enabling your children's emotional reactions. And one of the things that I always say, borderline personality disorder, but mainly personality disorders can develop, but borderline personality disorder specifically can develop at any age.
Okay.
It's the example I love to use to help people understand is Princess Diana. Princess Diana was a very emotional human being, very beautiful human being, and you watch her interviews, she talks about a lot of her symptoms in different forms.
She was really emotionally sensitive.
She was very emotionally sensitive.
Yeah.
And there isn't much evidence, I don't know if this is a fact, but I kind of use it as an analogy and an example, so if it's an inaccurate fact, My apologies. But there's no evidence of her having BPD-like symptoms prior to getting married and coming into this family, right? And once she came into that family, I could imagine the pressure, the invalidation of being so sensitive, the invalidation of how to be, and slowly that invalidation. You can come from a very loving family that understands your emotions, that helps you learn how to regulate, that helps you learn how to cope, that kind of like helps you handle your emotional reactivities, and you can go into a system, a family, or a marriage, or an environment, a country, or whatever it might be, and they start invalidating you, and they start telling you what you're doing is wrong, and words really matter, right? And we use cognitive behavioral therapy. There's a lot of videos that talk about manifesting, and the things that you say to yourself really matter, and the way you speak to yourself. Your brain is the smartest and dumbest organ, which is my favorite saying, and what you say to it matters, right? It goes the same exact way of what other people say to you matters as well, especially the people that you're surrounded by every single day. So what people say to you really matter, and if someone has this heightened emotional reactivity and a slow return to baseline, and the environment is constantly invalidating them, the brain, smartest and dumbest organ in our body, is going to develop coping mechanisms to try to protect you. Whether it's smart coping mechanisms or dumb coping mechanisms, the brain's job is to protect you. It's to protect you from hurt, protect you from harm, which starts building this coping mechanism that leads to borderline personality disorders.
Got you. But what would you say that it's really interesting that anybody can basically have some sort of like personality disorder at any point. But would you say that there's a specific populace or like an age range that you're more susceptible to getting those?
Not anybody.
Oh, okay.
The emotional reactivity
Right.
has something to do with it. So if someone doesn't have that heightened emotional reactivity and a slow return to baseline, invalidation doesn't harm them as much.
Right.
So again, if we go back to the emotional temperaments,
Yes.
right? Someone that doesn't have this heightened emotional reaction, if they're getting invalidated, like the first invalidation will like annoy them a little bit. From 0 to 10, they'll get like 2 annoyed. The second invalidation, they'll get a 4 annoyed. But they're still at a place in their brain that they can emotionally and logically put 2 and 2 together, and the brain will be able to like navigate that emotion with logic. But with someone with heightened emotional reactivity, when they get invalidated, they go from like 0 to 5. And then the next reactivity takes you from 5 to 7. 7, and like 8, 9, and 10 intensities, now you're in fight, flight, and freeze. Like 8, 9, and 10 emotional reactivity, you're in a place where your perception of the world and your thought process is officially in a survival response. So that's kind of where our problem solving and survival responses are where they become problematic for us, right? A lot of people, when they problem solve in like lower emotional intensities, sometimes we make mistakes and we make decisions in life that didn't work well for us, but it wasn't that we made a choice out of an emotional response, right? That's why in every business, in every career, in everything, they always say, do not make decisions in emotional responses, right? You don't want to make a decision in emotional response. You want to regulate yourself. But if you have that heightened emotional reactivity, invalidation from the world is going to amplify, and you're going to start making decisions in emotional responses.
Okay. So then it's dependent. Wow, that's incredibly interesting. So it really is dependent on like just your genetic makeup, your environment, as you mentioned. So it's a combination of everything that could lead you to getting a personality disorder. Or,
Yeah.
right?
Well, the reality is, what I like to say is we all have personality traits.
Right.
We really do. And
what do you mean by personality traits? Because I mean, layman terms, personality is like, yeah, I have a personality, you have a personality, but when you say personality traits, it's specifically for
Like if we look at symptoms of narcissistic personality disorder and borderline personality disorder, like I'll stick to those two main ones because they seem to be the most popular ones that people like to use as like that person has narcissistic, that person's a borderline.
It's like the grocery list.
Yes. That seems to be the popular insulting term to use, so which is very inaccurate. And that's like a TikTok thing that's starting to get developed. But if we want to look at narcissistic personality disorder traits and borderline personality disorder traits, there isn't a single person that goes through that list and can't identify with at least one of them at like different times in your life, right? And in current states, like if I go through that list, I can like look at that and be like, yeah, I can think of myself as grandiose sometimes. It's like I can become arrogant enough to think of myself as grandiose sometimes. But when we're talking about the diagnosis becoming a diagnosis, which is why I know a lot of people misuse the term they're a narcissist or they're a borderline, is that it means that it starts affecting your functionality. To kind of take this to a bit of a political place, like our president, unfortunately, the president of the United States of America currently is narcissistic personality disorder.
Yeah.
And every single one of those characteristics exists in him to the intensity where it's caused him harm in many ways. Like he's rich enough to survive it, but socially he's been in a lot of people haven't liked him in the time frame. I'm only 38 years old and I know Trump for like, I'll even say it since I was 14, 15. So I've known him for a shorter period of time than most people that have actually known him, and I've known him through the media. And I've known that people don't like him. I've known all the things that have been said about him. I've known all of the mistakes he's made in his career. Again, he has 6 bankruptcies. Whether he took advantage of the government and the system and did corruption and fraud on purpose, and people would like to call that smart, or his personality disorder actually caused problem after problem after problem where he made all these grandiose deals and he made all these big deals that he couldn't keep up with, and he had to keep filing bankruptcy. I don't know what happened in those rooms, but I do know that his personality disorder has caused problem after problem after problem, right? And if we even look at Donald Trump and his development, there is an article, and this is kind of to explain how someone with narcissistic personality disorder can become narcissistic personality disorder. The environment, there's an article where his mom, and I don't know if this is true, I'm fairly sure it's true because where I saw it was, it's an actual newspaper cover where his mother is speaking about her child, and in a public forum, and this is where I say, imagine a child growing up like this. In a public forum where everyone can read, the mother says, my son is not the smartest. That's very invalidating statement for a son to hear from their mom in a public forum, right? My son is not the best at certain things. Again, intense invalidation in a public forum. I hope he never becomes president. Ironic. Because he will make a muck out of the system. Again, chronic invalidation, but he is my son. And so she's kind of showing love at the end of it as a mother, because she is a mother. But still, these things are like, imagine in a private home having your parents say these things to you constantly growing up, right? These are things that are going to develop personality disorder traits.
Okay.
And if it's not a trait, it'll become a personality disorder. And if it's severe enough, it'll become a personality disorder. We all grow up in a system that one way or another invalidates us, says something or does something that creates some kind of trait in us, right? We all can experience borderline personality disorder traits. Like if we go with borderline personality disorder, fear of abandonment. It's one of the most intense traits in borderline personality disorder. The idea of being left. Even if they want to break up with someone, if that person breaks up with them first, they will panic and they will go above and beyond to try to fix that person not leaving them, right? We all can relate to not wanting to be broken up with. We all can relate to sending 4 text messages or calling the person and trying to like get closure on the breakup.
There's usually a lot more than 4 text messages.
We all could relate
Yeah.
to having personality traits
Yeah.
in different phases, because it's when you have that, when you're in a heightened emotional state,
Yeah.
you're making heightened emotional state decisions trying to regulate yourself.
Right.
And unfortunately, the American culture enables that. We do live in a culture that is constantly enabling heightened emotional responses, heightened emotional opinions, heightened emotional reactions, teaching walking on eggshells. Our education system has dropped tremendously because we didn't want our children to constantly be studying, and we wanted them to go and experience life and have fun and be with their friends. But instead of being with their friends, they ended up spending time on technology behind screens. So we removed books, and we removed like homework assignments, and we removed things that help them learn discipline, help them learn how to focus, help them learn a lot more, help them be able to have opinions, and we kind of told them, go have a good time, because you keep complaining about not wanting to do your homework, so let's remove that for you.
Or let's make homework fun.
Or let's make homework fun for
Yeah.
you, which is not supposed to be. Or even the concept of like, and I'm an athlete, and I understand the whole like giving everyone a participation trophy. And you're enabling emotional responses with that, because you didn't want a kid to feel sad about losing and having them cry and having them go through that painful process, where a parent is supposed to teach them how to regulate that, how to be able to fail, how to be able to lose, and it's okay. It's okay to lose. There is nothing wrong with losing, especially as a kid developing, right? Because it helps you learn how to pick yourself up and keep going in life and keep moving forward. But again, we so much so wanted to protect our children from these painful things that happen in life, that when they grow up, you protected them to the point where now they don't know how to deal with that.
And I think it's, as you're explaining this, it just makes so much sense to me about as a teenager, right? That's a moment in time where I felt the most heightened emotions, where I actually kind of like, I felt like I was understanding these emotions in its entirety for the first time and dealing with that. So would you say that dealing with, like, as an adolescent, right, or adolescents are more prone to dysregulation and adopting?
Oh my God, yes.
Yeah. Okay.
So one of the things that I actually say to the adolescents a lot of times that come to our office, first of all, every adolescent has personality disorder traits. Like, that's just, you walk into...
It makes so much sense.
You walk into middle school and high school,
Yeah.
like, you see it.
Yeah.
Because that is the phase of development in the human body. Which, again, I say this to them, and I'm like, you're an animal. So just like a dog is developing, and you know how like a dog and a cat, and you see them develop from like their puppy years into their adolescent years, it's faster for them because they're dogs and they don't live as long as humans do. Humans, now the brain during adolescence, the brain is now developing a different kind of emotion. So there's a phase of emotions where parents used to call them the terrible 2s to the 4s, right? The terrible 2, 3, 4s, sometimes, going to the 5s. That's where emotions are starting to get built. That's where you see the most tantrums. That's where you see the most. And if you have a kid with heightened emotional reactivity, that's when those poor parents are like, really, it's really the patience to teach this kid how to regulate those emotions and how to behave and not throw a tantrum every time they're not getting something they want, and how to not enable it, and how to like have consequences and hold boundaries with something so small and so adorable and so cute, except when it's not, because it's going through its emotional tantrum.
Right.
What I tell people, I'm like, that phase, the 2, 3, 4, and 5, comes back at 12, 13, 14, 15. It comes back in a teenager format. It comes back with hormones developing.
Yeah, they're bigger, they're smarter.
And now their hormones are starting to
Yeah.
shift, right? Now you're going into different hormonal development. There's a little bit of sexuality that's starting to come out with that. The hormones are starting to bring some of that into it, right? You're starting to see their bodies change. A lot of times I'm like, your bones start hurting because you're starting to grow and you're starting to have a growth spurt, right? And that's kind of where they start having personality disorder traits. And if not managed by the family system and the environment, and it's not just the family at this point, it's also the school system, because they're in school a lot of the day. So again, the American culture has removed support in our education system, unfortunately, where it's the most important place for our future and for the development of a healthier society. Being able to have teachers that are experienced, that understand how to help these kids learn how to regulate rather than take things personal that's happening in the room, which we used to have very, very good teachers at some point in time, and cultures that emphasize on education and emphasize on supporting teachers. They really do have more success rates with the future of the children and how the country develops as a whole and how each generation grows healthier. But right now in our system, unfortunately, we don't have the greatest educational system to support these hormonal kids going through personality disorder traits,
Yeah,
right?
Support our teachers
And no matter how good a teacher is, if the teacher's burnt out with 20-something kids and doesn't have enough supplies and it's kind of like the same thing a parent is, burnt out at home because they have to have 2 jobs to be able to keep up, and they have this emotional kid, they don't have the patience to understand how to regulate themselves with all of the issues that they have to deal with to help this child learn how to regulate themselves. So within adolescence, if it's not navigated effectively, at some point it turns into unhealthy adult patterns, unhealthy adult perceptions, unhealthy adult opinions, unhealthy adult actions, right? Which then becomes an unhealthy culture at the end of the day.
Okay. I want to bring you back to the therapy office. Right. So you have a patient or client and you're helping them, right? And you're using the amazing skills that you learned from CBT and DBT, right? Now, as your client learning these skills, how do they practice those skills? How do they use those skills to basically question those emotional responses that they've learned?
So the first thing I'll say, especially in our office, is we tend to sometimes work with very acute emotion dysregulation, right? Very intense emotion dysregulation. And when I do presentations and trainings with therapists, the number one question is, how do you get them bought into buying to utilizing the skills?
Right.
Because when you tell someone in a room, like, you're feeling really emotional and you want to fix, start breathing. And they'll look at you like, what? Like, how is me breathing going to fix my problems?
Right.
Well, it actually is.
Yeah.
And a thing that I always tell people, I'm like, planet Earth survives on water and oxygen.
Right.
Everything in planet Earth survives on water and oxygen.
Right.
So what makes you think water and oxygen isn't going to regulate you
Right.
and help you survive?
Right.
It's that simple of a concept. Water and oxygen, healthy water and oxygen, good water and oxygen thrives planet Earth and everything in it.
Right.
So breathing will help you thrive with your emotions. But it's very difficult to get people because dialectical behavioral skills and cognitive behavioral skills are skills that you have to use within yourself, right? They're not a pill, they're not medication, it's not a quick fix. But it is a quick enough fix that if you start actually practicing breathing every minute, you start teaching yourself to pace breathe. So pace breathing is take a deep breath in, hold it, and release it, and hold that. And you start pacing your breathing, you'll start noticing just even in a couple of days how much more regulated your high emotional reactivity is. Because with each breath, you're bringing that reactivity down. So if you're breathing every minute, 5 minutes, you're bringing that reactivity down. Even if it's out of 3, you're bringing it down. And if you're a heightened emotion person, if it's out of 3 and you're bringing it down to a 1, and you go to a 5 and you bring it down to a 3, and you go to a 4, you bring it down to a 2, you're constantly going high, but you're every 5 minutes without realizing, without hitting the 7 where you start noticing it, you're just regulating yourself left and right. With this one concept of breathing through your nose, holding it, and breathing out with your mouth.
And with that, so what are those skills? So, right, like what are the skills that you teach, and what are the skills that you use, and what's your favorite skill of all, if you have a favorite?
So dialectical behavioral therapy has 4 modules.
Right.
And cognitive behavioral therapy, so for me, it's all of them. Like it's those 2 modalities. And cognitive behavioral therapy is with your thoughts and learning how to ask questions, Socratic questions, and changing the verbiage that you say things to yourself, because words really matter. We've talked about this, right? Dialectical behavioral therapy is a concept of mindfulness, which means you start learning how to be a lot more present and aware of what's going on without judging. And the non-judgmental sense is my favorite skill as a human being. I think the more people practice non-judgmental stance and start saying things more factually rather than describing it in judgmental terms, they'll actually have a lot more self-awareness of emotions and things and unhealthy habits and perceptions that happen within us. And the best way for any environment to change is you have to start within. Michael Jackson said it so beautifully so many times, one of my favorite artists of all time. You look within yourself, you look in the mirror, and change happens from there. And mindfulness and practicing non-judgmental stance is the concept of starting to notice what's happening without reaction and without getting into actions. Then we have the stress tolerance skills. The stress tolerance skills are my favorite to explain. It's literally learn to say stop. So, like for me, I like to spend a lot, right? My poor husband talks about it all the time. I like to spend money. It's unfortunate. It's not good for my bank account. It is a problem behavior, and I work on it in therapy all the time for a very long time. I'm learning money management. I have to, when I'm walking the mall and I see the shoe, and shoes are my favorite. It's my favorite thing to spend money on. And I see this shoe and I'm like, oh my God, this is going to be perfect with 7 outfits. And I can already see myself wearing it, and I can see the validation I'm going to get from everybody on wearing this beautiful thing. And it looks great on my feet because I've already given in the impulse to ask the person to bring it out for me to try it on. When it comes to the point where I'm trying to convince myself why I need to buy this and why I need to have this, I have to learn to say stop. Stop, take a step back, hand the shoe back, go walk around the mall. If you still need it in 30 to 45 minutes, if it's still, like, distract yourself, don't ruminate about how you want that shoe. Bring that emotion regulation, regulate that emotion of wanting this thing by going and distracting yourself for 45 minutes with anything else. If after 45 minutes, once you've calmed down, you still want that shoe, go get it. You do the pros and cons. You decide whether it's going to be good for you. What are the cons of it? What are the consequences you're going to face? Are you willing to face your consequences? Are you Do you know how to regulate yourself with those consequences? If the answer to that is yes, then go ahead, go buy that shoe. But if you calm down, which 99% of the time after I calm down, I'm like, I don't need that shoe. I have like 4 that look just like it. I don't need it, and I walk away. Distress tolerance skills are pretty much that. It's learning how to stop, how to distract yourself from doing the action that you wanted to do. Within DBT, like I use a very everyday example, but within DBT that goes with like suicidal behaviors, suicidal gesture behaviors, addiction behaviors, excessive spending behaviors, and the distress tolerance skills are actually taught to those experiencing bipolar manic episodes. And although like that manic episode only lasts for 2 weeks, up to 2 weeks, if they ever experience it again, the distress tolerance skills help them get through that manic episode if it ever comes back again, to not cause problems and not get hospitalized and not go through their spending and business development stuff. And then you go into emotion regulation skills. Emotion regulation skills, I teach them as emotional intelligence. Again, every emotion has a function. Every emotion tells the human brain how to act and how to react, right? If you're able to start learning, once you practice mindfulness and you learn your emotional reactions and you start noticing them more, and you're able to start using distress tolerance, which means you're able to like stop and give yourself a second before you react. Then you're able to ask yourself, okay, I'm experiencing the emotion of anger. And my anger is telling me I want to scream at this person, or my anger is telling me I want to punch this person, or my anger is telling me I want to throw something at this person. And I've stopped myself enough, but I'm still experiencing the intensity, and I'm pace breathing and I'm regulating. But what's the function of anger? The anger is someone's blocked a goal. The anger is someone's blocked something that you wanted, or they've disrespected someone you love or yourself, right? Then I'm like, okay, what goal has been blocked? If it's a goal that's important, then this emotion is justified, and then I can like pick and choose how I want to respond to this anger. And now I have a lot more control over the emotion, so I can communicate with anger without punching or throwing things, right? Or I can think a bit more clearly. If it's like something I've wanted, but it's not really something like I said I want the car from my mom, and my mom said you can't get the car. But yeah, they blocked the goal, but is it really the effective thing, and is it justified to respond to anger to someone saying no to you taking their car? No. So your anger is no longer justified, which means you go back to distress tolerance skills. You stop, you walk away, and you go distract for 45 minutes. So emotion regulation, I call emotional intelligence, and I think it's one of the most, I think it's a skill set everyone should learn. I really do believe all of these skills are skills that everyone should learn.
I feel like all of them are kind of interconnected as well, right?
They really are.
Because like, to have emotional intelligence, you have to stop.
You have to tolerate the distress within.
Exactly. So you have to use that kind of stop skill.
Especially when you have heightened emotions, and the distress within is a very physical, intense reaction. You have to learn how to tolerate that physical, intense reaction.
Check the facts afterwards, right? Like, you're ruining. I have to think about it like in teenage terms, right? Because it's just like, I don't get the car from my mom. You're ruining my life, right? And that's the response, right? You're ruining my life.
Which, when you talk about borderline personality disorder, and in adult format, that's how they sound like.
Right. Okay. Perfect.
So it could be someone 42 years old diagnosed with borderline personality disorder, and they want to get a car, and the parent is saying no. They will respond in a teenager format. To be fair, because when they were teenagers, no one taught them how to regulate and tolerate the distress, and they didn't have consequences for their reactions.
Right.
Like, they might have gotten mad at them, and then like 2 hours later gave them the car.
Right.
So the tantrum worked.
Right. But then, okay, so outside, so if it worked as a teenager, right, and then you kind of get to that 42 years old, and you're still asking your parents for the car or not, you just have more consequences as you get older. So at that point, your response is at the same response as a teenager, but what you would do is stop and check the facts, right?
It's the same as a teenager.
Exactly.
It's the difficulty as a developed adult, which is after the age of 26 to 28, depending on the drugs you've used and all of that. A fully developed brain is already come up with its patterns, and it's like everything's already put together.
Yeah.
From its memories, it already is like a fully developed functioning brain. Nothing is developing anymore, right? The brain's fully developed. Now it's now just living, and at some point starting to deteriorate because we're starting to get older, and it's going to start deteriorating because everything in this planet deteriorates once it's fully developed. So, as a 42-year-old, you are now trying to undo all the things that have already developed, which means it's so much more difficult and a lot more work for you as a person. And also, you are now experiencing so much more shame and guilt because of all these constant consequences. And now your self-esteem is broken into pieces. You don't necessarily even have one at this point. So now you're working against a lot more difficulty, which means the work you have to put in is a lot more. It's a lot more difficult. You have to tolerate a lot more discomfort, and you have to learn to tolerate it. It's not an excuse that it's hard. You have to, for your life to get better, for these consequences to start getting less, for your self-esteem to start growing, for you to start actually being able to feel less shame and guilt within yourself about the things that are happening in your actions and in your behaviors, and for you to start creating a more quality of life, you have to learn how to tolerate discomfort.
Gotcha.
Which is something that in our country, and I say specifically our country, I can't really speak for the whole world because I grew up here, I've traveled a lot, but I speak for our country. Tolerating distress is something that we've actually taken out of teaching kids and people, and holding people accountable to tolerate distress is something that we've removed from our society.
So I'd like to take you back into the office. So
one last thing before you take me back in the office. There's one last module in DBT.
Exactly. Yes.
That is interpersonal effectiveness skills.
Okay.
Which is just learning how to communicate. It's
like communicate your emotions, or
communicate your emotions, communicate your wants, communicate your needs, how to have a relationship with a give and take, not just a give. How to stand up for your self-respect, because a lot of people actually have an issue, and this is not just with personality disorders. So many people in day-to-day tell me, like, I have a hard time standing up for myself or saying something about myself, like speaking up for myself. In interpersonal effectiveness skills, there's a section about Dear Fast, which is how to stand up for your self-respect, and then there's a Dear Give, which is how to like hold the relationship that's important to you. And how to balance your want with the person that's important to you, and not just stick to what I want and lose the person that I really love and don't want to lose. And then Dear Man, which is about how to ask for what you need or say no to somebody, to ask for a raise, to ask for things, and how to tolerate hearing no, how to tolerate having to give more than receiving sometimes, and having to make a decision of if a person isn't really good for my self-esteem and my self-respect, how do I end that relationship? So it's a phenomenal module for interpersonal skills as a whole.
In your experience, what have you seen? How do you make a person, or not make, but like how do they, again, kind of, I want to go back into the buying in. right, from a client,
Mm-hmm.
right, that is experiencing, like, is experiencing a personality disorder, and maybe themselves or their family has told them to go to seek therapy, right? How do you help them, or how do you kind of, again, help them buy in?
That's where there are so many therapeutic techniques
Right.
that really, really help in so many ways. And as a clinician, and I think this is one of the things that it's part of the job,
Right.
right? To learn how to help the person sitting in front of you, how to remove yourself and your emotions and your frustrations, how to learn to be patient and give them time to face what they need to face within themselves, and how to help them learn to help themselves. As a behavioral therapist, it's our job to help our patients help them help themselves at the end of the day.
Yeah.
It's not my job to save anybody. It's not my job to fix anybody. It's not my job to convince anybody of anything, right? But I can use therapeutic techniques, and I use therapeutic techniques from all therapy modalities. All therapy modalities, in my opinion, are extremely helpful. DBT might have been created by Marshall Linehan for borderline personality disorder, and I have seen so many clinicians not utilize DBT specifically and utilize like humanistic interventions, and have been able to help that person help themselves, right? And it's about using certain techniques. And with that being said, as a clinician, we use certain techniques and we help the person in the room. It's a job that we do. It's not just like me sitting here talking and being an empathic person and validating or invalidating, right? There's techniques and you have to learn how to do it. You have to learn the cues and the moments to pull something, to let something go, to allow something to exist, to let them sit in discomfort, to create discomfort and redirect them to learn how to sit with that discomfort. And when there's someone in front of me that's having a very difficult time, kind of like having so many justifications of like, well, I'm an emotional person and the skills don't work for me. And I've heard this so many times. And I've had so many people be like, the skills don't work for me. And my response to them is, how are you special? How are you different? Because these skills work with every human being.
Right.
It doesn't, if they even work on dogs. Like when dogs are regulating themselves, they take a deep breath and they shake it off. They don't all need medication to regulate themselves.
Right.
Even cats,
Right.
even every animal you look at, right?
Yeah.
So
Emotions are constant throughout. Like,
emotions
throughout
are
life.
constant throughout life, right? And learning how to regulate them is like basic things.
Yeah.
And if you don't, and one of the things that I bring it back to, it's your choice.
Yeah.
At the end of the day, it's your choice to help yourself with this life that you are coming here asking and telling me to help you figure out how to help yourself.
Yeah.
It's your choice.
Yeah.
You can choose to put in the work,
Yeah.
which is hard.
Yeah.
And no one's taught you to put hard work in. I
Right.
get it, that's kind of why you're here. No one's actually taught you to put in the work that's hard.
Yeah.
And you're starting to learn now
Yeah.
as an adult. Adolescents, they like will laugh at your skill, but they'll actually practice it and they'll start realizing it actually helps, and they'll like practice it without telling you, and you'll start seeing the change.
Yeah.
But adults are a lot more like, that's not going to help me, and a lot more adamant on. And this is not just with personality disorders. There are other people that don't necessarily meet the full criteria, but come in because they're like personality traits. And there's a lot of people that I even talk to every day that are not willing to change. If you're not willing to change, then you're just going to keep facing consequence after consequence after consequence, and that's your self-esteem. It's your choice to keep going down that route. It's a choice. You can choose to actually accept that you have to put in the hard work and start trying this simple hard work that is to breathe. Start there. And you can choose to practice that and implement it and give it time and see if it helps or not, and see if it works or not, which 100% of the time it's going to work. There's no way you can tell me it doesn't work. Even if you're 10 out of 10 in the most suicidal state or in the most impulsive state, if you breathe for if you put a timer in for 3 minutes, just breathe. Just pace breathe for 3 minutes straight, you'll see that it works. You might be re-triggered very quickly, so you might have to do other skills to regulate yourself and fully come out of that episode. But it will work enough to get you to at least go from a 10 to a 7 or 10 to an 8 even. So what I always tell them is at the end of the day, it's your choice to help yourself.
Right.
And that's every human being.
What would you say is your favorite part of what you do?
My favorite part of what I do is when a person actually gets to the point where they're willing to try to help themselves. And they start coming in and they start saying, like, I this went well, that went well. I was trying to think about what to talk about. And I'm able to look at them and be like, you don't need therapy. So stop wasting your money on therapy and start go living your life. And life is not going to be easy.
Right.
You're going to need these skills.
Right.
Life is going to have its moments of difficulty, and I'm always going to be here.
Right.
But congratulations, you graduated. And you no longer need to come see a therapist and try to figure out what to talk about and find something that's wrong with you. Something will be wrong with you later on, and you'll come back.
Yeah.
But until something doesn't come to you behaviorally, you don't really need to come here. If you want to do more process-based therapy, I refer them out, which more often people just want to take a break. It's like kind of graduating college, and before going into a master's program, you want to take at least 3 months off before you
10
go.
years.
Some 10 years. But you kind of need a break. So my favorite part is when I'm able to tell the person, you came in here really not knowing what to do, not knowing yourself, thinking that you were never going to be able to solve the consequences and never going to be able to get rid of this shame and guilt and whatever it is inside of you. And now you're done. You did the work. You finally gave in to the basic skills. They worked. And enjoy your life.
Go fly.